Happy Friday, everybody, and welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, why liposuction is the #1 plastic surgery in the United States. And then, U.S. overdose deaths decline for the first time in years. Good news. And then finally, what is designer breast surgery? We're going to talk about it, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. Please crush that like and subscribe button. Turn on those notifications. We really do appreciate it. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is Sarah.
Hi.
Hey, Sarah. How are you?
I'm good.
Great. In the box, we got Travis. What's up, man?
Hey, how are you?
Doing good. Everybody have a good week?
Yeah.
Anything exciting? Usual stuff?
No, not really.
No?
Same old, same old.
All right, big question. Mike Tyson, Jake Paul.
Mike Tyson. I hope that it's Mike Tyson.
Trey, what do you think?
Yeah, I want to go with Mike Tyson, but I'm not sure. Youth can sometimes prevail.
You know, I'm going to go with Mike Tyson, but I think if Paul can stay away from him, he might be able to wear him out. I mean,
Yeah, sure.
Tyson's 58 years old, like.
Right.
But man, I've seen the videos of him training. He still looks really good, and he's Mike Tyson.
Yeah.
Yeah.
I think I'm going to try to go tonight, actually.
Oh, yeah,
One
that's
of my
dope.
friends is going to.
Really? I don't have tickets, but there's still a lot of tickets available, so I'm going to kind of wait and see if they drop in price a little bit.
Yeah.
I mean, why not? I mean,
Why is one of them getting paid, like Jake Paul's going to get paid $40 million, and then Mike Tyson's only going to be paid $20 million? Why is there such a big...
Paul gets double?
Yeah.
I don't know. I had no idea.
Yeah. I'm like, why is that?
That's
I feel like because it's his, like, brainchild. Like, this is
Oh,
his... Like,
he came
thing.
up with it?
I feel like, I think he came up with it, if I'm not mistaken. Like, he's the one that, like, fights the celebrity... like people.
Oh,
so
but
this is his
does
thing.
does he get it only if he wins, or that's just what he gets for
No,
participating?
I think that's just his cut of it. 40 million, 20 million split.
I mean, I don't know if 40 million's worth getting your head knocked off by Mike Tyson. No, he may get like beat up. I really have no idea. I know the odds are saying that it's going to be Paul. Like
the
betting market.
interviews with Mike Tyson, he looks like he's like honed in. He looks like scary.
Yeah, I mean, he
looks-
always looks. He still looks scary. I don't know.
His face is just like, I don't know. It's crazy.
So
But
we
I'm
got-
sure it's all part of.
So you think, Trey, you're
the
gonna
thing.
see? You gonna say Paul or you gonna say Tyson?
No, I'm saying Mike.
You say so. We got 3 Mike Tysons.
Mm-hmm.
Yeah.
I agree. I think Tyson's gonna like probably knock him out. I know
Yeah.
that sounds crazy, but dude, it's Mike Tyson, man. The guy still got it.
Yeah, well, he quoted something like, "I'm gonna probably knock him out in the first round if he doesn't keep running away from me." But he looks like the type to run, and I was like, "Oh dang!"
I don't know. I think I'm gonna go. I mean, why not? It's one chance to see Mike Tyson. There's tickets available. I mean, there's a bunch of fights though. I don't know any of the other fighters because I don't really follow boxing a lot. But
Oh, are there like ones leading up to it?
yeah, I think there's 7 fights total.
Yeah, they have like
that's
a
cool.
couple different undercards.
Yeah, like there's 2 like top ranked women boxers are fighting. I don't know their names, but I mean, it could be interesting.
Yeah,
So.
for sure.
Cool.
All right, well, I'll give you guys a full report next week. All right, let's move into some segments. So, all right, do you guys remember when it was like 6 months ago, we were doing the most popular procedures for 2023. You guys remember what the most popular was?
I guess liposuction.
Oh, did you already see it?
No, that's just the topic.
Oh, yeah, that's right. I said it. Oh, my gosh. It's Friday. Some Fridays, man. Yeah, you're 100% correct. Yeah. So I wrote this on the card, and it made sense in my mind that when I asked you guys wouldn't know the answer. All right, back on track. So yeah, absolutely. So as of 2023, the ASPS, or the American Society of Plastic Surgeons, procedure and statistics release. It comes out like in the early summer, I think. And I think we actually talked about it. We were talking about what's trending, what's different. Throw that picture up there, Travis. I'm going to talk about it. Oh yeah, there's the title. So why liposuction number one plastic surgery. So this is the report. And just to kind of recap the top 5, liposuction, roughly 350,000 surgeries done, breast augmentation, a little over 300,000, tummy tuck, 170,000, breast lift, 154,000, and then blepharoplasty, which is eyelid surgery, 121,000 procedures done in the United States. Nothing really shocking there. Liposuction and breast aug kind of like flip-flops back and forth between number 1 and number 2 each year. I think lipo's had it for the last 2 years. So somehow I got talking about this past week with a patient because we were talking about what are the most popular procedures, and they were kind of surprised that liposuction was number 1. And then, I started thinking about it, and it's a little surprising to me, too. I mean, just based on the consults we see. And so I thought it'd be interesting to talk about why is it number 1. And so I think the main reason that it pops up number 1 on this list is because liposuction is done with so many other procedures.
Yeah.
I mean, we talk about the big one that I hate all the time. You know which type of surgery I hate?
Yeah, BBLs.
Yeah, Brazilian butt lift. I mean, Brazilian butt lift is liposuction. I mean,
I had liposuction on my.
Oh, you did when you had your surgery?
Yeah, because the doctor was trying to get rid of my little chicken.
Oh, yeah.
I call them my little chicken nuggets, but he didn't really get rid of them.
Accessory breast tissue. Yeah.
He didn't get rid of them.
Yeah, in fact, I've done that many times. And so I think that's why this pops up number 1 on that list. I mean, because you never hear people talking about, I just went and got liposuction, by itself. It's I went and got liposuction tummy tuck. So there's a lot of procedures that get liposuction in conjunction with it. Brazilian butt lift, tummy tuck is super common. I probably do liposuction on 75 or 80% of my tummy tucks. Arm lifts and thigh lifts, it's really common just to kind of thin it out. Gynecomastia repair, which is when men have like the man boobs going on. Any other fat grafting, so like when people do fat grafting, with a facelift, there's going to be liposuction. And then, of course, like all the isolated liposuction procedures that are out there. But all in all, outside of the fact that it's done with a lot of other surgeries, it is extremely popular. And, I think it's worth talking about, why is it so popular? So, the main reasons come to me, very predictable results. If somebody knows what they're doing, liposuction's pretty straightforward as far as getting the result that you want.
Yeah.
It's basically sculpting is all it is. And, most plastic surgeons are artists, so they can, get a good sculpt at the end of the day. Recovery's pretty easy. I'd call it easy to moderate. Definitely not a bad one. Complication rates overall very low. I'll kind of go over those in a minute. And then, when you look at the patient satisfaction rates, it's very, very high. But, for people who are either thinking about liposuction, or just want to learn more about it. There's a saying that I always say, I don't know if I made this up or I heard it somewhere. I don't always hear other people say it. I may have made it up. I don't know. But it's, yeah, I know, right? Liposuction is a contouring procedure, not a weight loss procedure.
Yeah.
You shouldn't go into liposuction if, you feel like you need to have your whole body liposuction. At that point, then it's best just to lose weight. And of course now with, things like semaglutide, that's become easier than ever. But the main goal of liposuction is, I think if you're doing it by itself, it's contouring, meaning, if you have like a place where fat's bulging, that's a great use for it. But if you come in and you say, well, I want to liposuction my entire leg, not so good. Well, I have people come in and ask that, not all the time, but from time to time, they'll come in and be like, can I just get liposuction all over? And there's people out there that do that, and surgeons, and it just puts you at risk. When you start to liposuction that much, it starts to become a little bit more risky because when used as intended, it's
so
actually.
So, for girls, do they, what do they come in for the most? Because if
for
they're,
lipo?
For legs, is it, your inner thigh?
Inner thighs, yeah, that's the classic one.
And then, for stomach, it's, that little lower belly.
Yeah, lower, yep, that's exactly right. Yeah, those are, well, I'll tell you, the area that I liposuction the most by itself would be I call them the flanks. Yeah, the love handles or the saddlebag area. I call them flank. It's that area. The two places that women gain fat the most are tummy number 1 and then 2 the flank. So basically your sides but going around towards the back.
Yeah.
And so what I end up doing a lot is, I do tons of tummy tucks. I usually do about one a week. In fact, I just finished one an hour ago. when you do a tummy tuck, you'll make everything in the front really, really flat. But then, a lot of times women will have a little bit off to the side, and then they notice it more.
Yeah.
And I'd say probably, 1 out of 3 or 1 out of 4 tummy tucks come back and end up liposuctioning that later. I don't like to do it at the same time. I actually did that early on in my career, and I noticed that when I liposuction people on the sides with a tummy tuck at the same time, they were more
too much.
Yeah, they were more prone to have like healing problems. Like nothing terrible, but I did notice that, and so I've gone away from doing that. And now, if they want to do that, then we do it a second. But as far as like how liposuction is done, I mean, it's fairly straightforward. The first thing you do is you inject the area of fat with something called tumescent fluid, and so tumescent just means like swollen, but the tumescent fluid is basically a solution of normal saline, and then it has epinephrine, lidocaine, and bicarbonate. And what the tumescent fluid does, it actually does several things. One, the epinephrine decreases bleeding.
Okay.
It's really effective at constricting blood vessels. And so, when we do liposuction, I mean, most people hardly lose any blood at all. The lidocaine helps for anesthetic. I do almost all of my liposuctions under general anesthesia just because it's so safe. And we can dive into that, I guess, in a little bit as far as can you do under local. You can do these surgeries under local anesthesia, and in that case, the lidocaine is super important. But the other thing it does is when you inject the fat tissue with this fluid, it makes it firmer, and then it's much easier to sculpt.
Oh.
Yeah. So the tumescent fluid does a lot of things. So you inject the tumescent fluid first. I usually make 6 millimeter incisions. So you're talking an incision about like that. They're tiny. I usually do 2 per area. So if I'm doing an area here, I do them at 90-degree angles. So I do like 1 here and like 1 there. And so that lets you kind of cross hatch, so you're not getting the cannula going all in one direction. So I make the incisions, inject the fluid. I usually use the debulking cannula at 6 millimeters. I got a picture of a cannula. I remember adding one. I'll throw that up there just so people. Yeah, so that's a classic liposuction cannula. It's longer. It's probably 3 times as long as it's shown in that picture. And then on the end is like a metal piece that connects to a suction hose. And so it's not sharp at all. It's actually blunt. And when you apply suction to that and run that through the fat, it's very effective at just kind of shaving it down, almost like I said, almost like you're sculpting. So yeah, I debulk it with a bigger cannula. Then I go to like a smaller one so that I can like just do I call it fine feathering. It's basically tidying it up and making sure everything looks exactly the way you want.
Yeah.
And then you close up your incisions. I mean, it's pretty easy actually. There's artistry in it for sure, and so you have to kind of have that eye or the experience to make it look right. But technically, it's not challenging. As far as like the post-op instructions, pretty straightforward. You got to put compression on there because what ends up happening when you do liposuction, you're sucking that fat out of an area, and it makes a space. And anytime you have a space in your body's natural reaction is to put fluid in there, especially when there's inflammation from the trauma of the surgery, like your blood vessels get leaky, and they don't necessarily leak blood, but they'll leak the serous fluid. And so, we put compression on that to basically smush that space back together. So did they put compression on your arms or your side area when they did it?
No, I still have a scar from it.
Oh, do you? Yeah. Yeah, I mean,
But
really.
I scar really easy.
Do you? Yeah.
Yeah.
A-
Olive skin.
A little small area like that, it's not as critical to put compression. But like if you're doing big areas of liposuction, like your flanks, your abdomen, your thighs, you definitely want to wear compression. If you don't, you significantly increase the risk of complications. No exercise or heavy lifting is also a very important instruction, and you got to give yourself time to recoup. 2 things about liposuction that definitely need to be known for something considering. One, swelling is 100% normal and expected. In fact, I tell my patients that, depending on how much you're taking out, like the swelling may mask that you've had the procedure at all, especially if you're doing something small like inner thighs or like the chin, which is another area where you're just barely doing liposuction. The tissues are going to swell, and you can come out of this and not even see that anything is done.
Yeah.
So you have to like educate people about that so they don't freak out. Of course, if you're doing bigger areas of liposuction, they never swell as much as you take out. So, they're seeing like a partial result. It takes about 6 weeks for the majority of the swelling to come out, and then it can take up to 6 months for that last little bit. So just got to be aware of that. The other thing that's really important to know with liposuction is what is the skin going to do? Because what happens when people lose a bunch of weight?
They get saggy.
Yeah, they get saggy skin. Well, when you do liposuction, it's instantaneous.
Yeah.
And so it's not like if you're, losing it with diet and exercise or, even things like semaglutide or weight loss surgery, that it can be fairly fast, but not as fast as lipo. I mean, lipo's instant. And so the skin doesn't have a time to kind of snap back as much as when you're doing it more gradual. And so that's definitely something that you have to think about when you're doing this is, okay, are you doing so much liposuction that you're going to be unhappy with how your skin looks? And once again, preventing problems or, unexpected results is all about your surgeon explaining that to you. But if you know that going in, you can ask your surgeon, hey, is my skin going to be loose? Most of the time, skin will snap back, and then it's just a measure of like how much did you remove? How old is the patient? Is the skin quality good? Is it bad? A good surgeon can tell you what to think about the skin. As far as risks of surgery, we talked about, I think just like a couple months ago, we talked about the dreaded risk of lipo where I think we were
like
talking.
You can like hit an artery or something.
Yeah, get internal with it. Like
I think somebody got in trouble.
Yeah, I think you're right. Yeah, you like hit the liver, hit the intestines. I mean, you really have to like either one, not be paying attention. Like,
yeah, it was a case. The person,
the girl
died.
Did she die? I can't remember. It was the girl who lost her license because she was TikToking.
No, there was another person.
Oh, there was another one. Oh my gosh.
He like ignored it and sewed her up, and then she like went to like go somewhere else to fix it, and then she died or something.
Man, I don't know if I'm getting older if we've just done too many segments because like it's like we talk about
because they all kind of sound the same, and we're every single time we're like, whoa,
wait a second,
how's that happening?
Yeah, so that's like the big dreaded risk is if the liposuction cannula gets way out of bounds and causes an injury, realistically a good surgeon should not have that happen to them in their career.
Yeah.
It should be a risk of like 1 in tens of thousands. It can happen, but it really shouldn't. But so like, what are the real risks? I mean, to me, the biggest risk of liposuction far and away is seroma, which is when people collect fluid. I've had it happen to me twice in 15 years. I'm not sure those patients.
That's not really something you can control as a doctor. Right?
Really not. No, I would agree with that. I mean, I think probably the biggest risk factor for people getting seroma is if they're not just religious about wearing the compression, or if they're like overly active, which is hence why the number 1 and number 2 instructions are wear compression and no exercise or heavy lift. Yeah, I've had 2 seromas that I've had to deal with over the years, which is not bad. I mean, that's over 15 years. And then the other is the other risk would be if like the skin scars down to the muscle if they over liposuction people. I always talk about that when we're talking about Brazilian butt lifts, how they like, skeletonize these people's fat and then sometimes they'll scar. There was, I can't remember if it was Britney Spears it was Tara Reid. Remember that girl from the 90s? She was like in American Pie.
She looks rough now.
Does she really?
Oof.
Oh, I haven't seen her.
She's
I'll have to look her up.
Oof.
Really?
Yeah, she looks like
she's not aging well.
She
she's like
looks
living the hard life.
she lives in a house where drugs are.
Oh
That's what she looks like.
Okay. As soon as we stop this episode, I'm totally gonna go look her up. Okay.
You need to.
Anyway, Tara Reid, if I remember correctly, got some liposuction where they overdid it, and there was
On
a
her
famous.
stomach,
yeah. Have you seen that picture?
Yeah.
Oh, okay, cool. Yeah. So you don't want that. I've never, knock on wood, have never had that happen to me because it's just a matter of leaving a healthy layer of fat tissue underneath the skin. And then lastly would be any contour issues, meaning, did you make a mistake in your sculpting? I've gone back once or twice and touched up something, but it's exceedingly rare. So I get a bunch of questions about liposuction that are kind of interesting, and so I kind of like made a little list here. So will the fat that you remove, will your body put it somewhere else? It's not a bad question. Answer to that's no. I mean, just because you pull fat out of one area, it doesn't mean that suddenly your body's going to be like, oh, well, there's no fat in the abdomen. Let me go and put it on your butt or somewhere. No, that doesn't really happen.
The way you said that, sorry. Let me go ahead and put it on your butt.
Yeah, like your body's like, we're going to have to like compensate for this somewhere else. Can you gain the fat back?
Yeah.
Yes, you can, of course. Sure, yeah, you can. You can get it back. It's basically like getting you where you want to be, but then you're starting fresh, right? So you got to make sure that you kind of keep the body that you want. Will you need skin tightening? We were just talking about that. That's definitely something the surgeon should talk to you about. Your surgeon should go over what's going to happen to the skin. If they don't, then they're not really giving you all the information, which I'm really big on that. So. But yeah, so all in all, lipo is a good surgery. It's at least in my opinion, mostly done in conjunction with other things, but on its own, it's great. I mean,
it sounds like it depends. It obviously depends on the doctor, but it sounds like it depends on the patient, I guess, to keep it the best.
Right.
In terms of taking care of it afterwards, and then
not
definitely gaining it back.
Yeah, following the instructions.
Most effective, I guess.
I definitely think that the patient's got a lot of
more responsibility.
Yeah, responsibility. It's important to follow the instructions so you don't get a problem, and then you have to maintain it afterwards.
Yeah, because it's not like a boob job. You can't just
right.
You're not going to lose your boob.
Yeah,
your boobs aren't going to get bigger, and they're not going to get. I guess they could get bigger.
I mean, they could. If you
just in terms got bigger. All around.
But the thing is, with lipo, you're targeting an area where your body likes to put fat there.
Yeah.
Right. So anyway, all right. Let's recap this one real quick, Trey, if we can. So today we were talking about liposuction, how it is the #1 most popular plastic surgery in the United States per the American Society of Plastic Surgeons. There's a lot of reasons for that. I mean, one, it's done in conjunction with a lot of other surgeries, so that's why the number gets bumped up a lot. It's done with Brazilian butt lifts, it's done with tummy tucks, it's done with arm lifts, thigh lifts, gynecomastia surgery, any type of fat grafting. But on its own, it's a great surgery. It has very predictable results in the hands of a good surgeon. The recovery is overall not a bad recovery, and the satisfaction rate is very high. There's a couple of things I think are very important to know about liposuction. One, liposuction is not a weight loss procedure. It is a contouring procedure. It is for changing the contour of an area that doesn't look the way you want. It's not for losing weight if you have areas all over that you want to get rid of. Another important thing to know is what is going to happen to your skin. When you take away fat instantaneously, the skin can look loose. Definitely need to talk with a surgeon to see what's my skin going to do after this. And it depends on a lot of factors, like how much fat are you taking out, what's your skin quality, what's your age. So that's an important thing to know. And then also, please know that if you get liposuction, the swelling is absolutely going to happen, and it can hide your results, and you just need to be aware that when you look at yourself the first time, you're not seeing your real result. So, but yeah, I do lots of liposuction. It's great surgery. In the right hands, it's very safe and has great outcomes. So there we go.
Very good.
Moving on.
Yes.
All right, we always do sad segments. I actually have a happy segment.
Oh, yay.
I mean, it's happier. Yeah, we talked many times on the show about fentanyl and the opioid crisis. I don't know how many segments we've done, 2 or 3 at least. I think the last time that we did one was when the data came out last year about how many deaths there were and just how staggering it was. It was last year 113,000. Well, year before it was 113,000 opioid deaths, mostly attributed to fentanyl. We were talking about, what a bad problem it is and, what can we do? And, no one really has, a great solution to this. So it's kind of all bad news. But today, this past week, I should say, there was some good news. So the CDC released its yearly drug overdose data this past week. And so in the past 12 months, there's actually been a overall decline for the first time in many years in the overdose deaths in the United States. And so we talked about how 2 years ago it was 113,000. This past year it went down 14%, so down to 97,000. I think I got a graphic there, Trey. Can you throw that up just people want to see? Yeah, so this is the opioid drug overdose deaths since, about 2015. And you can see that this line has gone up, with the only exception being 2018, which was the last time there was a decline. And then you see when COVID hit, it really kind of shot up. So,
wow.
Yeah, pretty crazy. So overdose deaths in the United States have been steadily increasing since the 90s. In the 90s, it was just the opioid pain pills. People were taking too many pills.
Yeah.
Then heroin hit in the mid-90s. It probably was there before, but it was attributed more in the mid to late 90s with the heroin epidemic that was hitting the United States. And then, of course, the big one, fentanyl. When fentanyl hit, God, when was it? Like in the teens, I guess? Yeah, it was probably the early teens.
I didn't really start hearing about it that much until like 2 years ago, though.
Yeah.
Like heavily.
It was funny, when fentanyl first hit, in my mind, I didn't realize that there was like an illegal drug market for it, and I was like, people are stealing fentanyl from the hospital, or like they're getting
where is it coming from?
I was like, what's it coming from? But then I found out that like cartels are either buying it from, I think they get it from either China or India, and then distribute it, or they get the precursors and make it themselves. Yeah, crazy stuff. But yeah, there's been a dramatic increase in opioid deaths, as we saw in that chart, since COVID, and lots of reasons for that. People are isolated, or they were. Everybody was hunkering down, working from home. Of course, when it's like that, there's less access to treatment, and there was a pretty big explosion in the number of fentanyl deaths. And like I said, we talked about it a couple times, and for those who may not have seen those segments, the reason that fentanyl is so dangerous is just that it's so strong.
Yeah.
And so I think I have a graphic that we've probably used a couple times over the years. Yeah. So this is pretty crazy. This is relative opioid potency. And so I put morphine as like base 1, right? So because morphine is like the drug we use in the hospital very, very commonly. And so, if morphine's 1, lethal dose 200 milligrams, which is it's roughly the size of a pea. Heroin's twice as strong, so lethal dose is half as much. Fentanyl is 100 times stronger than morphine. 2 milligrams can kill you. That's the size of a sesame seed. And then, of course, the bottom ones, sufentanil and carfentanil, are like the derivative drugs of fentanyl. I think we talked about one, maybe a segment a year or so ago. They're actually seeing some of these derivatives, or at least the police were reporting that they were getting some. I think the base fentanyl is what's out there the most.
That's scary.
Yeah, it's crazy stuff. This stuff is just so strong, and how it kills you, basically just you stop breathing, and then you die. It also can bottom out your blood pressure. I mean, there's a lot of things it can do. So I guess everyone's asking, so why is there this decline in the deaths? It's gone up in the past 6 years, and suddenly we get this this decline. I think it's for a lot of the reasons that the CDC mentioned and these articles were mentioning. There is an increase in the access to Narcan. You guys remember Narcan?
Yeah, it's like the
spray. Yeah, so it's an opioid reversal. It's extremely effective, and the nice thing is it basically has almost no side effects.
Yeah.
And so if somebody even thinks somebody might be having an opioid dose, it's not even IV med. It's like a spray you sprayed up your nose.
Yeah, and like police
like
officers
Afrin.
have it.
Yeah,
like
we have some in our house. Yeah. So if you're watching this, get some Narcan. I'm pretty sure you can get it now without a prescription, just over the counter. It's a little pricey. I think when we bought it was like $40 or something. But it literally can save the life of somebody who is in an opioid overdose. And I think that there's a lot more Narcan out there, so maybe that's helping. There has been a big expansion of overdose prevention and addiction treatment programs, so that's good. There's been, allegedly a big crackdown on fentanyl. I mean, and you can see it. There was, I read this article just this past week when I was researching this. So in 2022, the police and DEA seized 44 million individual pills of fentanyl. 2023, 115 million. They seized almost 3 times as much. Which, you like to think that maybe, is the police seizing this actually decreasing the amount out there? It's probably just due to the fact that there's just more of it out there. I'm not sure that that's necessarily the reason, but maybe. And then the last one is kind of like a very morbid or grim reason that it's down. Some people are postulating that the reason the fentanyl deaths are down is just killed so many people that there's just fewer people out there that would use it.
Yeah.
I mean, there are a limited supply of people who are, in a spot where they're willing to take a drug like fentanyl. I mean, it's not like alcohol, right? I mean, I think that we can definitely make the distinction that that people who have a drink
have a serious problem
versus fentanyl. I mean, it's completely different. And so, there are a limited number of people out there that'll do that. And, the sad reality is maybe it's killed so many that there's just less people for it to kill. There should be noted that with this data that the decline in the overdose deaths was not uniform. Most states in the eastern United States went down, but oddly enough, most in the western United States went up. But the overall trend was down for the entire United States. I did check our home state of Texas. Do you think we were up or down?
Down.
Trey?
Yeah, I would have said down.
Nice. You guys are exactly right. We were down 3%. So not a huge drop, but in the instance of something that's gone up and up every single year, even small percentage decrease is good news. Alaska, Washington, Oregon actually were way up. They were around 27.
Alaska's always had a bad drug problem, though.
I think it's just so. I mean, I love Alaska. Don't get me wrong, but I think if you live there, it can be depressing, especially with like the endless winter. You know, where it like never, or they get like 2 hours of sunlight a day or something crazy.
Like everywhere up there seems, there's so much prettiness around, but then there's also like no sunlight over there.
Like in the winter, yeah.
Like that's like that in Seattle too.
And then honestly, as much as I love sunlight, it would probably freak me out if it was daylight all day long.
They have that too there in Alaska.
Yeah, I know. Yeah, I know, right?
Like it's either like night forever or sunlight
it's like the eternal
forever.
night or the eternal day. It's like your brain just doesn't know how to process it, I guess.
Crazy over there.
Yeah.
All their brain hormones are
like
off.
their circadian rhythm just must be shot. Like there just probably is.
They're
none.
like, I'm alive.
I think if they buy like the special lights and stuff in their house for like the day, and they turn them on and it mimics sunlight, and then at night they have like the blackout curtains. So
for sure.
Yeah, a little sidecar or side trip into Alaska. All right, it is beautiful though. I love it, Alaska. Not saying I don't like it.
Get off drugs. I'm just kidding.
Yeah, please don't take drugs. All right, big question though. You know, that everyone wants to know is this a true decline, or will we see just another increase like we did in 2018, where in 2018 it kind of went down just a little bit and then it went like straight up.
Yeah.
So
why did it go down then?
I don't know. I'm not sure they know. I don't know. Because I don't think we were doing, maybe it was education. Maybe at that point, fentanyl was new enough that not enough people knew that, hey, this stuff is like super dangerous. Like think twice before you just throw a handful of pills in your mouth.
Yeah.
Maybe it was just education. Because I don't think we had like the Narcan and like all of the treatment programs that we have now.
Maybe.
It might have been just educate. I mean, that's purely speculation, but it makes sense. So.
I have no idea.
But yeah, I think it's good news. I mean, definitely, we've had a lot of bad news about the opioid crisis, and we've had a lot of bad news about fentanyl. And like, hey, we have like a little bit of good news. So I think we build upon it. I'm hopefully smart people are in there looking and seeing, okay, what worked, what didn't work, and we can continue to make improvements on this. So, all right, let's recap this one, Trey. So today, we were talking about some actually happy news in the opioid crisis. So for the first time in 6 years, there were less overdose deaths due to opioids in the United States than the previous year. That's great. It actually went down about 14% from around 113,000 deaths down to 97,000 deaths. So of course, although there is a decrease in the number of deaths, this still is a crisis. As far as, why did things go down, or why did the deaths go down? I think that Narcan is much more available now. So Narcan is the reversal agent for people who have an opioid overdose. If you're not familiar with it, and I recommend anyone get it because, if you have, young people in your life or people who are at risk for potentially using drugs, it can absolutely save their life. We personally have a couple in our house ourselves, just in case. There's more treatment programs, prevention programs are getting ramped up as the United States has gotten more serious about this.
I think probably just cracking down.
I think cracking down, yeah. Cracking down may have played a part in this. There's been a lot more seizures of fentanyl this year, 3 times as much. So everybody's wondering, is this real? Are we starting to see a plateau and potentially even a decrease in number of overdose deaths in the United States? That's to be seen. Certainly it could go back up like it did in 2018, which is the last time it went down. But hey, good news is good news. So I think that we build on this and see if we can get this trend down and get this crisis under control. So, all right, very good. All right, last segment.
What do we got?
I know it's funny. I'm a specialist in breast surgery. Plastic surgeon. I did a fellowship in cosmetic breast and body surgery. My title of my business is North Texas Breast and Plastic Surgery.
Yes.
I do breast surgeries multiple times a week. So I always find it funny or odd when I see an article about plastic surgery and it's talking about some breast surgery thing that I've never heard of.
Yeah.
I constantly am doing research for the show. I like to keep up to speed on everything. And with all that experience and knowledge, I still will find things. I'm like, what is this? So that happened to me this past week. Today we're going to talk about what is designer breast surgery. Have either of you guys heard of designer breast surgery?
No.
Never.
Trey, tell me about designer breast surgery. Any idea?
I could not tell you.
Okay, all right. I had no idea what this meant either. So I found an article. Throw up that article in case anybody wants to look at it. It's not great. I'm just going to let you know. So what does the term designer breast surgery really mean? All right, that just came out.
It's not good.
Well, I kind of figured I knew what they were going to say, but let's see what they say. So the article defined designer breast surgery as a highly customized approach that many surgeons now bring to their work, aiming to create results that feel uniquely tailored to each patient.
Well, if the doctor's not doing that, then they ain't doing their job.
Sarah, you could have absolutely done this segment. You're 100% correct. So in the article, it actually quoted a plastic surgeon I know, Dr. Calabrese. He elaborates. This begins by focusing on the patient's anatomy, frame, and personal goals rather than a standard approach. Yeah, this article is just kind of dumb. I mean, I just don't even know how to say it. Like, Sarah, you absolutely just hit this on the head, that what they're talking about is literally what
Doctors are
every
supposed to do.
plastic surgeon should do for every single patient. However, I will, in their defense to a certain degree, say that I do see patients that get in with some plastic surgeons, and it's almost kind of like a
Factory.
Like
Yeah.
everyone gets the same thing. It happens, and what ends up happening is the patient gets something they don't want.
Yeah.
And that's bad. But I'm not sure that we need to call the right thing a special word like designer breast surgery. This is a marketing gimmick for sure.
Yeah.
I mean, you're right. It describes a technique that literally everyone should use, and although it doesn't happen. So what can we learn here from this article? Well, I think that the one thing I could probably help people out is to tell you what would include in a good consult. Because if you don't get a good consult, I do think that you should, at the very least, get a second opinion, if not just completely turn away from the surgeon that you went to.
Yeah.
This is a service industry, right? You're not going to get a breast lift or breast
For
aug.
your medical health.
Yeah, for your medical health. So
For fun.
take your time and find someone who is going to give you the best chance of a good outcome.
Yeah.
So, I think kind of like the big takeaways from getting a consult for breast surgery, whether it be aug, lift, or whatever, is to find someone that is going to spend the time to make sure that you and the doctor are on the same page, and that your expectations are for sure going to get met. Mm-hmm. And so when I do these consults, man, I don't blow through them. A fresh consult for me is easily 30 or 40 minutes.
Yeah.
Between describing the procedures, doing the exams, showing pictures and whatnot. So with me with breast surgery, when people come in, I have questions I want to ask. So number one, what are you trying to accomplish here? What's the goal? And sometimes patients can tell me very specifically. They're like, I want it to be bigger. I want it to be fuller, so on and so forth. And sometimes patients don't know.
Yeah.
They don't know. They just know they don't like it, but they don't know exactly what they want to do to get it better.
I don't like this. Fix it.
Yeah, right. I have people literally say that. And so at that point, that's where the surgeon's got to step up and spend the time to see exactly what it is. So other questions I ask are, do you want to be fuller, right? Do you want to be bigger? Do you want to improve the shape? And so when I ask those questions, and the other thing I also ask is, do you have a specific look that you want? And so a specific look, some people come in, they say I want the stripper boobs. I literally have people tell me that. Or they'll literally say, I want the porn star boobs. And I know exactly what they mean. I mean, everybody knows what that is. Or they'll say, I don't want something I want completely natural. Or I want something that's proportionate. And I'll say, did you bring any pictures in? Pictures are helpful.
I think I was the unprepared one.
Oh, were you?
I went to mine.
Did your surgeon do you right, though, and spend time with you?
Yeah. I mean, I had
Pretty
one
good.
consultation.
You did, but you didn't,
But to me, I didn't really know what I wanted. I just knew that
You just want something different.
I
Yeah.
wanted to be bigger, but I
Okay.
also didn't want to look weird.
Okay. I mean, that's helpful. That's
I
at
wanted
least a
it to
start.
I wanted it to look normal, on a person my size.
Yeah.
I didn't want it to look weird.
Yeah.
Yeah.
Right. Okay. So you ask all these questions, and what you're basically trying to get at is, okay, what procedures does this patient need, and how exactly are you going to do it? So kind of the three procedures, that mostly we're talking about here is breast lift, which improves shape and increases fullness, breast implant, which improves fullness and increases size, or a combo of both, a lift and implants, which will improve the shape, increase the size, and increase the fullness. And I think it's important to dive into that because I have a lot of people come in and want a breast augmentation consult, and come to find out they just really need a lift. Like they have breast tissue, but it's just not where it's supposed to be, and they don't have a full, upper pole, and so they don't like the way they look in bathing suits and dresses. And all they really need is a lift.
Yeah.
But if the surgeon doesn't take the time, or maybe they have their nurse doing the consult, like that patient will get set up for an augmentation and get that and then be upset because now they're much bigger than they wanted to be. They may be full, but now they're much bigger.
Yeah.
Right? And then they're unhappy and they're coming to me in a year or two and like, I don't want that. I have that happen all the time, so many times. So I guess, to this article's defense, yes, this article should have been titled, "Make sure your surgeon does a proper consult." Like that's
these are
what
the things to
this is
look
what
for.
this is what normal should be. So yeah, I go through all that with the patient. I talk about different implants. So I have a standard implant I use most of the time, but if people have very specific requests, then I will dive into, okay, would maybe one of the specialty implants be better for you? I use a sizing system if we're doing an augmentation consult. So I put them in a bra and I have these little special gel inserts that go in. And so they can literally put these inserts in until they get to the size that they want. And
I
then
think I remember that.
they do that for you. I think we actually talked about that at one point. Yeah, that's great. I love that. It works very well.
You let me feel what a saline one feels like, and
Yeah.
like silicone.
Nowadays, we don't have the saline. We used to have the saline, so we don't have them in the office anymore because they're just not used. But yeah, the sizing system works great to make sure that when you get on the other side of this, that you're going to get exactly what you want. But yeah, the bottom line of this is that if you were going to have plastic surgery, whether it be breast surgery or anything, it is a surgeon's obligation to listen to you and make sure that you guys are on the same page so that there's no surprise in outcome and you're going to get what you want. Mm-hmm. And if you don't feel like that happened 100%, you should absolutely go to a different surgeon. I don't like when plastic surgeons have their nurse explain the procedure and then the surgeon just rushes in and looks at you and be like, okay, we'll see you next Friday. You're much more likely to get, and I worked with people like that. I remember when I was in training, and I've worked with a lot of people, and some people did a really good job, and I was like, okay, I feel good about this. And other times it was like that, where they just rushed in and rushed out. I'm like, yeah, I don't like this. Mm-hmm. This is not how I'm going to do things. So, designer breast surgery, that's just a marketing gimmick. That's not the take home here. Any good plastic surgeon is going to give what this article is calling designer breast surgery. It just means they're going to listen to you. They're going to tailor a plan for you. They're not going to do some cookie cutter operation,
Like at those little plastic surgery mills.
The plastic surgery mill. Yeah, that probably does happen a lot there. Where people just get kind of a one size fits all treatment.
Yeah.
Or it's
I'm an A, and they're like, okay, so you want to be a D.
Yeah,
bye,
you want
next.
to be D. Yeah, next. Ding.
Yeah. See ya.
Now serving number 43. Yeah. So I think there is something to learn from this. I didn't like the article. I thought it was just fluff. But I like at least what they're trying to do, which is to make sure.
They're trying to make it sound more sexy instead of saying this is just a good breast augmentation.
Yeah, I guarantee what happened
designer.
is, one of these people that they quoted in this article made up this term designer breast surgery, and they're pushing it. It's like, oh, I do designer breast surgery, right? And people if you're a consumer, you're like, geez, that sounds pretty good.
That
actually
sounds like something I want to buy.
I would want a designer, whatever it is I'm buying. I want the designer chainsaw or
the chainsaw.
Whatever. Right? It just sounds like it's.
Those are definitely made in a factory.
Yeah, it's definitely. I want the hand assembled chainsaw or whatever. No, but it makes it sound better. But the thing is, it should be like that no matter what. That whole thing they described should be industry standard. So, all right. I think that we've probably beaten these topics to death for today. I think that probably we're gonna move on to the next week.
Yes.
Yeah. So, all right. Let me know what you thought about this episode. Leave me some comments. If you leave us comments or questions about things you want us to talk about, I promise you we will talk about them. So leave it on social media if you see it there or on the YouTube channel. Thank you guys so much for tuning in, and we will see you next week.
Bye.